Hello, my name is Teresa Valentino. Happy 2019. And I'm doing a Paramedic Ask Me Anything. Glenn Riley wrote in and asked me how to prepare for or pass the National Registry Paramedic exam. So first of all, congratulations, Glenn. I'm glad that you are going to become a paramedic, and I'm glad that you asked me for my opinion on this. So I know you didn't say what stage of the process you're at. I know that when I started to Google how to pass the National Registry or prepare for my National Registry, I want to say had just completed the midterm in my paramedic year, so I was about a year and a half into my process, and I had about another 6 months to go. So by this time, hopefully you have already established a good working rapport with your FTOs and your leadership in your school, because those are all of those people. It's a giant network, and it's important that you understand that they are sizing you up for appropriateness for duty, like from the first day you walk to the door. So that's something that you need to understand. They all communicate with each other. They all give each other recommendations and referrals, and you have to have already put your best foot forward. You have to have already shown up sober, on time, clean, ready to work, and glad to be there. So in case you have not already been that person, you can still turn it around, okay? I want you to go to a thing called my.firefighterNation.com and look for Shut Up and Train More from Fire Rescue Magazine's Nozzlehead. Shut up and train more, and 49 other tips every probie and all of us should know. If you look through that and you've already got your attitude in check, then that is a huge part of establishing yourself into a new career. So keep in mind that I took my National Registry. I took it one time, passed with flying colors, both the practicals and the written. Thank you. And that was just 11 yesterdays ago. I want to say 2003, maybe 2004, 2005, 2005. So it was a long time ago, 15 years or so. So, but I'm sure that the basic stuff, I'm sure everything in that Nozzlehead poster is still true today, okay? So I'm sure you also have a paramedic textbook that it could stop a bullet or could be used as a deadly weapon, as I did. And I dragged that thing around like a small child with a teddy bear for, you know, a year, and studied it nonstop in every down moment that I had between calls. So my book actually was held together with duct tape by the time I got finished, and I had to throw it away because the binding was completely broken and it was just a mess. So that's what I'm saying about how much of the book reading you should do. So you've got your ACLS, you've got your PALS, you've got your BTLS, your CPR, all of that is good to go. You've got all of your side certifications, in other words, that you will need. My best advice to anyone wanting to become a paramedic is to run as many high volume, high acuity calls at the BLS level as you possibly can. So in other words, like you as a EMT basic, in support of a paramedic unit is the ideal way for you to train, because it's always going to be BLS before ALS, and that's going to be also true on even the written portion of the registry exam. Understand that the registry exam is not there to trick you with goofy stuff, okay? But they're there to make sure you are really paying attention and that you really know your stuff. That said, they always do have a few written questions about stuff like epiglottitis or HHNK or like a thyroid storm that, you know, they really are kind of probing and testing you to see if you've learned what you were supposed to learn, because you were supposed to have done like a A&P class by now. I mean, there's a bunch of other side learning that goes into that, and they do expect you to be able to incorporate all of those different elements into even things that are not maybe necessarily within your paramedic textbook, but they expect you to have pulled all of that together. So you have to know your book, you have to know your formulary and your protocols up one side and down the other. But frankly, some of the stuff, some of the medical emergencies that you will face in real life are not necessarily covered by a protocol per se. So for example, like thyroid storm is one example that I gave, and this is something I learned on the street. Once you learn something on the street, you will definitely pass it on the test, you know what I mean? Because if you have seen someone having a thyroid storm, and then you get to that portion of the textbook where they explain it, what the symptoms are going to look like and what you're to do and everything, that will make sense. There's really not a lot you can do, in my experience, for a thyroid storm, but get him to the hospital ASAP. A thyroid storm is often someone who will present as, for me, it was an older guy over 40, and I think that can be a lot of times it's somebody over 40. But they appear to be having a cardiac arrest in terms of like the pale and the clammy. But instead of, you know, a lot of times if you go to a regular chest pain guy that age, like in his 50s or 60s, that guy is going to be very kind of weak. Like he can't really move a lot. He probably can't breathe a lot. He's very frightened. He might be shaky, but he's not going to be combative. If you go to a thyroid storm, that guy looks cardiac, but he's like combative. He's like an animal. You can't even get the leads on him. If you do get the leads on him and manage to somehow get a reading, get him to sit still for a minute so you can take a reading on his heart, it's going to be basic because that's not the problem. It's the thyroid. So, but that, you know, they have to manage that at the hospital. Really, you just get them to the hospital. So obvious stuff like never go outside your protocol. If they try to trip you up by seeing if they can get you to try to you know, do a C-section in the back of the truck or something, then you have to like, remember, is this in my protocols or am I branching out? Am I making stuff up that I've never seen or heard of before? Then, you know what I mean? Common sense stuff like that. The thyroid storm, a couple of other things that I learned on the street were like cocaine chest pain. If you get called to a chest pain and you hook them up and it's a legit, like, it's a legit tombstone T-waves, like they're fixing to die, and they're under 50, let's say, it's cocaine, basically, or methamphetamine, something like that. Usually for my area, it was cocaine. We had a lot of cocaine overdoses, and that's how it was. So that you have to understand when you see that chest pain person who there's really very little likelihood that they are actually having a heart attack. It's usually almost always a drug thing. So the cocaine chest pain is something. And then a lot of times overdoses will be like older people in nursing homes that I have seen it a lot of times, unfortunately, in nursing homes where the people taking care of people don't know the difference between a medication prescription and a brand. Like they think that it's just a different brand instead of an actual completely different medication through that patch. Like one lowers blood pressure and one is for pain, like two totally different medications, both in a patch, not just a brand issue. So that can be a nightmare. And I've seen it where sometimes people had, when this lady is to get a fentanyl patch, they just keep reapplying and they give her another one every 3 days. What they mean is take the old one off and put a fresh one, right? But then they've been doing it like every 3 days. They just add another one. She's got like 9 fentanyl patches on. So stuff goes wacky at the nursing home. Anyway, certain things, once you've seen them in real life, you're just not going to fail them on the registry test because bottom line, people are not mystery eggs, okay? The human body has what it has, does what it does, and that's all she wrote. So you get your basic stuff down into your muscle memory, you know, your IV monitor, O2 monitor IV. See, it's been a long time, but you know, you just know what to do. You just get it down to where your training and experience can just kick in. The more experience you can get, the better off you will be. The one with the most information wins. So if you are stuck, if you don't know what to do, and your protocols are not helping you and you're not able to get information from someone more experienced than yourself, look for more information. Basically, ask yourself, take like 16 vital signs on every call. How about that? And then my teacher was kind of a trivia nut, and that will help you on your registry as well. So one of the things is that I'd like you, Glenn, to know is the 6 degrees of burns, okay? So if you can explain or describe the 6th degree of burns, and that is a real thing, and that's true, and that could be on your registry test because that's how many. It's not just 3rd degree. So think about them apples. Stuff like that. But bottom line, if you've been showing up at your fire service or you've been running your clinical calls on time, in a good mood, in a good attitude, there to work, there to learn something, there to be helpful to people, they want you on board and they're going to help you get on board. If you have any significant deficiencies, they will have noticed it and they'll be working with you about it by now if they want you around. You know what I mean? So you have to make yourself valuable. You have to make yourself somebody that has something to give them, and then they want that because there's a huge need for it. So I hope that that helps you, Glenn. I hope that that answers your question, and I also hope that you will get back to me and tell me how things go. And if you have any other questions, please do hit me up. I don't have a lot of paramedic stuff on my blog, but it's Teresa at teresavalentino.com. There's no H in Teresa. And you can write me with questions or just leave them on my YouTube channel. See ya.